Hi everyone, Dr. Peterson here from Regions EMS. This is the daily update for Sunday, March 22nd, 2020 for the coronavirus COVID-19 pandemic. All of the information from our Thursday video, March 19th, which is still available on our YouTube channel and on our website, all of that information and recommendations are still current. Just like to focus on a couple additional points today and make a few points of emphasis. We're still dealing with a critical shortage of PPE, as we probably will throughout this pandemic. So again, just try to limit your exposure as much as possible, minimize the number of people involved in patient care whenever possible, especially with stable patients, and use the recommended PPE when needed. Just be aware that we probably will run out at some point. So be smart about which PPE you're using on which patients and save the heavy hitters for the patients that are really going to need it. A couple other things, we as EMS and emergency providers need to be practicing social distancing just as much as everyone else. We're working on that in the ER to try to not have people huddling around workstations whenever possible. And for you, I think that applies to the ambulance entrances at most of the facilities. As much as you can, try to avoid gathering in those vestibules, in those entryways where patients are coming and going. Also be mindful of where you're doffing and disposing of your PPE so that you're not coming through the vestibule, the ambulance entrance, in PPE, removing your PPE, cleaning your equipment while there's other crews bringing in a non-infected patient through the same entryway. So just be mindful of that. You'll likely see in the coming days some traffic pattern changes at various hospitals, so you won't necessarily be entering and exiting through the same door, but just be mindful of that, as well as in the station as much as possible. If we were to suffer any hit to our EMS workforce, it would be catastrophic to this area. So just protect yourselves and your partners as much as you can. Cardiac arrests, we need to be very selective about which patients we transport. PEA and asystole, we really need to work those on scene and not transport them to a hospital unless you truly believe that there is something the hospital can offer that you can't. That's rare. Survival for these conditions obviously is very minimal, and it's very rare that we have something at the hospital that we can offer that you can't in the field. Obviously, if it's an ECMO patient or traumatic arrest that you think that still might be resuscitatable, that's one thing, but for the standard asystole PEA arrests, which are the majority of our arrests, just think twice before you transport and make sure it's really the right thing to do for that patient. And then finally, check into our website, regionsems.com. On a regular basis, we will keep up-to-date resources posted. Even if we don't put out a daily video every single day, we will update that page and let you know when the last time the information was reviewed so that you can be confident that that information is current and up to date. We have a number of resources available right now, guidance for first responder responses, when do symptomatic public safety professionals need to be tested for COVID-19, how to appropriately clean your Motorola radios and body cameras, as well as a summary of the information that we're presenting in this video. So check that out. Feel free to contact us with any questions you might have, anything you want addressed in future videos, emseducation@healthpartners.com. Otherwise, stay safe, and we'll get through this. Thanks.